Posterior meniscal root tears of the medial or lateral meniscus. Meniscus extrusion leading to joint space narrowing. Acute or chronic meniscal avulsion injuries. Degenerative meniscal tears in younger, active patients. Introducing the Auxein meniscus root marking hook, designed for efficient access in tight joint spaces. Its low-profile cutout slides smoothly beneath the femoral condyle with minimal obstruction. A 360 degrees variable angle rotation and higher entry angle ensure precise, perpendicular alignment at the root footprint. Used with the Auxein #0 BioBraid suture loop, for secure and reproducible meniscal root fixation. Position the patient supine with the knee flexed to 90 degrees, supported laterally, and the leg hanging off the table. Create anterolateral and anteromedial portals for scope and instruments. Use a ring curette to decorticate the posterolateral aspect of the medial tibial plateau. Check meniscal tension using a tissue grasper. Assemble the retro drill guide handle, meniscal marking hook, 4.5 mm retro drill sleeve, and 2.4 mm guide pin sleeve. Place the marking hook tip at the tibial plateau after verification. Seat the bullet firmly on the tibial surface. Drill a 2.4 mm tip pin through the bullet until it reaches the marking hook. Open the side flap and remove the jig. Remove bullet, leaving the drill tip pin in place. Pass BioBraid suture loop through the meniscus using Neoscorpion suture passer. Adjust Neoscorpion suture passer angle up to 90 degrees to avoid cartilage damage. Pass second BioBraid suture loop similarly. Remove the drill tip pin. Introduce third BioBraid suture loop with suture shuttler through tibial tunnel in the joint space. Retrieve the suture loop using suture retriever through the AM portal. Load both suture loop ends on the third suture loop and retrieve through the tibial tunnel. Remove third shuttle loop and load suture into 4.75 mm gyrolock. After retrieving sutures, cycle the knee for secure fixation. A 3.5 mm drill bit with drill sleeve is used to create the hole for the 4.75 mm gyrolock. Gyrolock is advanced to the entry of the drilled hole while maintaining firm tension on the sutures. Sutures are marked at the reference line on the gyrolock shaft for accurate anchor placement. Slide gyrolock eyelet to suture marking. Screw in the gyrolock to secure sutures on the tibial surface. This completes the medial meniscus root repair using Auxein's meniscus root repair instruments. Restricted weight bearing for 4 to 6 weeks to protect the repair. Knee brace or immobilizer as advised by the surgeon. Begin gentle range of motion exercises within the first few weeks. Physical therapy to restore strength and knee function. Avoid deep squats or twisting until cleared. Gradual return to full activity after surgeon approval. Regular follow-up and imaging to monitor healing.